Welcome everyone to our webinar today on using Social Security benefits planning to support the transition of an individual from school to work. My name is Sue Kellum, and I work at the LSU Health Human Development Center in the area of transition, employment, and careers. I'm joined today by Rose Angelosi, who will introduce herself when she starts with her slide in a few minutes. So welcome to this session. We're glad to have you here. The objectives of this session are that you will learn the different types of Social Security disability benefits and how earnings affect each of those benefit types, the use of work incentives that can be used to lessen the impact of earnings on benefits, and third, how to use employment networks and agencies, including state vocational rehab, in supporting the transition of somebody from school to work. Some of the key takeaways that we hope you will agree with are how to contact the Ticket to Work helpline in order to be referred to the WIPA benefits planners, how to apply work incentives available to working students under the age of 22 that will lessen the impact of earnings on their Social Security benefits. And third, how to use those employment networks, including the state rehab agencies, to support the transition from school to work. So we hope that you're going to be able to take some of this theory and put it into practice in your own communities with those agencies and the students that you're working with. So Rose is going to talk about the Social Security Administration and the benefits that are available. Go ahead, Rose.
Okay. Hi, I'm Rose Angelosi, and I am a benefits planner with the West South Central WIPA program. And I'll talk you through some of these benefits and the work incentives that can be applied. So Social Security has two major types of benefits here. One is the Social Security Disability Insurance, or SSDI, which also includes a CDB, or that's a childhood disability benefit, or what we call a DAC, a disabled adult child, or disabled widow's benefit. And then the other benefit is SSI, or the Supplemental Security Income, SSI. So today's presentation is really going to focus on SSI benefits. I suggest that, if you are more interested in learning about the SSDI benefits and their applicable work incentives, please contact us to kind of go through those. They're different than the SSI work incentives and a little more complex at times. Contact is either way, though. Okay. So let's talk about SSDI first, just so to define the definition of who might be receiving these benefits. So Social Security Disability Insurance, or SSDI, they're paid under Title II and are meant to partially replace income lost when a worker retires, dies, or develops a disabling condition that prevents them from doing substantial work. So they might be paid to retired or disabled workers, their dependent family members, and or the surviving spouses and dependents, children of deceased workers, okay, or somebody who is under the age of 18 or between 18, 19 and still in primary or secondary school, if their parent is disabled, retired, or deceased, or what we call the disabled child. So our DAC benefits somebody who is between the ages, like if they're 18, but their disability is diagnosed before the age of 22, they may continue to receive benefits as a dependent of a retired, disabled or deceased parent. All right, SSI, Supplemental Security Income. So this is a needs-based benefit that's intended to augment any income that you may already have to meet the minimum needs for food and shelter. It's typically issued on the first of the month. And each year that rate, it's based on the federal benefit rate. So that changes a little bit each year. And the benefit that one receives is adjusted by Social Security on the monthly basis, depending on somebody's reported gross income. Federal benefit rate. This rate is set each year, and somebody can receive the full benefit rate when they're responsible for their food and shelter. So this year, for an individual, the federal benefit rate is $943. So last year, for an individual, it was $914, and last year it was $1,261 for a couple. This year, in individuals, $943, and a couple might receive $1,415. In-kind support and maintenance, or ISM. So Social Security is going to look at somebody's living situation and see if they're contributing to their food or shelter. So if they think that you're given help, assistance from someone else in terms of the food and shelter, it's considered a certain kind of unearned income. And they call this the in-kind support and maintenance. All right, value of the 1/3 reduction. So if they do believe that you are getting support from someone else, and if someone doesn't contribute anything to their food or shelter needs, Social Security is not going to give the full benefit rate. So if they lower that benefit rate this year, it's about $628 instead of the $943. Now, Social Security also looks at resource limits when it comes to SSI. So they look at what's in the bank the first of the month, and the resource limit is $2,000 for an individual and $3,000 for a couple. All right. Now, considering the resource limit, if one is in a position to start saving earnings, it may make them ineligible for SSI or even Medicaid, because Medicaid also has the same resource limits. So let's talk about ABLE. ABLE accounts. It's achieving a better life experience. And this is a way that people who acquire their disability before the age of 26 can save money and maintain eligibility for public benefits. So the beneficiary themselves or other people, their family or friends, can contribute to this account. So this year, the combined total can be $18,000 for the year, but if somebody is working, they can add another additional $14,580 possibly if they're not participating in an employer-sponsored retirement plan. So none of the money deposited by others or any investment gains are accounted as income for these need-based benefits like SSI and Medicaid. It's excluded from the resource limits. Okay. And this money can be used for qualified disability expenses like education, transportation, employment, training, assistive technology, and healthcare. And you can learn more about ABLE accounts at this website. All right, so people who receive SSI in Louisiana automatically get signed up for Medicaid for health care. And whether you're receiving a cash benefit or not, it's still possible to maintain your Medicaid, even if the SSI check drops to 0. You can earn up to $38,748 in income, provided you're still eligible for SSI in general. You meet other criteria. Just the earnings is stopping you. You still have to meet that resource limit. And just all the other assets that are allowed. So you can still retain your Medicaid. SSI redeterminations. So every year, Social Security looks to redetermine if someone is still eligible, looking at non-medical factors like somebody's income, resources, and their living arrangements, to make sure they're still eligible, make sure that the payment is correct, that at least their projection is correct, and they do this at least once a year. Now, when somebody turns 18, they look at it very closely to redetermine if somebody is still eligible. The definitions of disability are different depending on if one is below the age of 18 or above the age of 18. So sometimes in the redetermination, people may no longer be eligible because of the definitions. So within a year after a beneficiary turns 18, Social Security is going to review the eligibility to see if somebody's still eligible. And they're going to try to collect, information, what medications somebody's on, hospitals, surgeries, doctors, work activity, counseling, therapy, any schools, special classes, tutoring, and maybe checking with teachers and counselors who have knowledge, about somebody's condition. So usually in this process, about a third of people no longer qualify for disability, but during this redetermination. All right, Sue, why don't you walk us through the SSI calculation? How is it calculated when we have earnings?
Sure. So we're going to give you a little bit of an example of what the way that Social Security approaches looking at the wages and what they'll exclude. So not all of an earned income counts when you're determining a person's eligibility and what their payment amount will be. There are 2 exclusions that Social Security will take off if they apply, and for most people, both apply. So we have a general income exclusion of $20. I know it's not that high, but every little bit counts. And then we have an earned income exclusion of $65. And so the total amount is 85. So you might hear us saying 85 later when we do some other calculations. Then Social Security will divide the subtotal of those exclusions taken off the gross wages. they'll divide that by 2. And then they will apply the applicable work incentives in the order in which they happen. And then that's going to leave you with the amount of your SSI check reduction. So here's that formula again. So the basic SSI calculation, and we're saying this because lots of people sometimes, they might not have the gross wages, or, we need to make sure we're using the right numbers. So that's why as CWICs, we want to help the individual do this and to forecast what their deduction of their check might be if they were to get a job working a certain number of hours and at a certain wage. So the formula goes like this. It's their gross monthly wages, and you subtract the $85, which is the $65 and $20 exclusion we just talked about. And from that subtotal, you're going to divide it by 2. And then that's going to be the amount of the SSI check reduction. So we don't have the work incentives in here, but we know where to add those in if the situation warrants it, if you qualify for some type of work incentive. So this is, really not a bad scenario. So we're going to look now at an example. This is just totally an example. This $640 a month is just an amount of money I made up for somebody working part-time, obviously, making $640 in gross wages in a month. And so, that's not a bad part-time job if that's what the person wants to work and that's all they feel like they can work right now. So we take the 640 gross wages and we subtract the general $20 exclusion and the earned income exclusion of 65, and we're left with $555. So that's kind of right now what they're looking at. That's what the gross wages are. So they divide that subtotal by 2, and the total countable income is what we're left with, which is $277.50. So what will happen is that will be the amount that their check is going to be reduced. So in the very bottom calculation, it says base SSI rate and subtract total countable income. This is where we're looking at how does Social Security do this? Well, they take that base rate, if that's what you're receiving, the $943 for 2024, and they subtract the figure they just did in the formula, the $277.50. And the new adjusted SSI payment is going to be $665.50, which of course is less than the full $943, but for every $2 the person earns, they're only losing $1 in their check. So they almost double their money. So it's far better to be on SSI. This was always intended to be a supplement to a low wage. It was never intended to just provide the basic income for somebody. So we want people to realize they can go to work, they can get the deduction, and we can help them kind of plan what it is how many hours they could work and those sort of things. So for this person, their adjusted SSI payment was $665, but now we have to add in their gross earned income. And at that level, that's probably pretty close, even with deductions, they'd still be making above 600. So 640 and 665.50, that leaves this person with a new total financial outcome of $1,305.50. Remember, before they were making the $900 federal benefit rate. And so this is a lot more, plus they're going to work, they're meeting friends, they're engaging in their community, and hopefully they're finding a way to use this extra money, which I think anybody could. Okay, and now this is a work incentive. So Rose, are you going to do those, or do you want me to?
I can pick up here.
Okay, great.
Okay, so like Sue said, the calculation there is not always the end of the story. There may be work incentives that apply. They don't apply to everyone, but we look at them on a case-by-case situation here. There's special rules that make it possible for people that are receiving either SSDI or SSI to work and still receive monthly payments and their health care, either Medicare or Medicaid. So there's different work incentives depending on if somebody gets SSDI versus SSI. So that's why it's real important to check to see which ones apply to your situation. Okay. All right, so we're going to focus on the work incentives for SSI. So one is the student earned income exclusion, impairment related work expenses, blind work expenses, and the plan for achieving self-support over the past. All right, so let's first talk about student earned income exclusion. And this is available to people who are on SSI and they're under the age of 22. And if they go to work and have earnings at the same time while they're attending a full-time training program, they could be eligible for this exclusion. And then if someone's part of a couple, only one of the parties would receive that exclusion at that time. So this year, in 2024, the exclusion per month is $2,290 per month. Somebody could earn and be excluded, but there is a cap for the year, is $9,230. And this, of course, changes, each year as well. It may go up a little bit depending on the cost of living. Okay, Sue, let's walk through an example, some case studies here.
Okay, so here we have Rachel, who is in a post-secondary education program, and she is doing a paid internship with a hospital in central maintenance and supplies. As a student intern, she's earning $10 an hour and is working part-time, just 12 hours a week. Her total monthly income is $480 each month. Based on that, Rachel's monthly earnings will be below the 9,230 limit or the cap, and it will have no impact on her SSI check. So the key thing is here, she's earning $10 an hour, she's working 12 hours a week. Her total monthly income is $480 a month, and so she's far below the 9,230 limit, so she can work several months at that 480 before she ever even gets close to the limit. So the good news is students that are doing this, that are on SSI, can make some money, and it doesn't even count towards reducing their check, because it's an opportunity for students to gain some work experience. This is example number 2. John, he works at a call center part-time. He earns $20 an hour and he works 20 hours a week. So his earnings are $1,600 a month. So he's working a little more, and he's also making a higher hourly wage. So his monthly earnings are still below the monthly student earned income exclusion amount. However, he will earn more than 9,230 in about 6 months, and where there will be an impact. So he will be able to earn up to that 9,230 and not have any deductions in those months. And then once he goes over that limit, then they will do the deductions as per the formula we just showed you in the previous example. Rose, impairment related work expenses.
Yes, okay. So impairment related work expenses are expenses that are related to the disability for which you qualified for benefits. You might be receiving some kind of care or treatment from a healthcare provider for this condition. The expense is necessary for somebody to go to work, and it's paid out of pocket by the beneficiary, and it's not something that's reimbursed by insurance or vocational rehabilitation. And it's something that somebody spent in the month when earnings were received. The expense has to be reasonable. And sometimes that the cost of the expenses, if it's a big ticket item, they might be able to spread that cost over time to be considered as an impairment-related work expenses for several months, for a period of time. Okay, so it's important to maintain receipts for these expenses. And it's really up to Social Security to decide if they're going to accept this as an impairment-related work expense. And this is something that can be requested in writing on a form SSA 795 is the way to request it at present. And really the only way to make these requests are in writing. The other reporting systems we'll talk about in a little bit, you know, don't allow for these requests to be made. Okay. I just want to mention we're not covering the blind work expenses here, but they do incorporate impairment related work expenses and beyond, but we're not covering that in detail in this presentation at this time. So, Sue, go ahead and walk us through an impairment related work expense calculation and take us on through.
Sure, and thanks for mentioning that, Rose. It's critically important that if you are working with people who are blind, that you get those numbers, and we are happy to give you those, so you can reach out to Rose or I, and we can provide you those and also give you some instructions or some help with trying to determine what the differences are for someone who's blind. So this is an impairment related work expense scenario. We always call impairment related work expenses IRWEs because, you know, it's a big long handle, and that's Social Security calls them as well. The name, though, is very telling. As Rose said, it's a work expense that you have as a result of your impairment and a result of going to work. So an impairment related work expense. All right, so Debbie receives $943 in SSI, and we all know now that that's the full federal benefit rate for 2024, and she has Medicaid. So let's see what happens when we do an impairment related work expense for Debbie. She began working for a social services agency, earning around $640 a month. Because of her disability, she has to take paratransit at the cost of $36 a month. So that would be her impairment related work expense, because transportation to work is not an impairment related expense. But if you need to take, because all of us, everyone without a disability has to find transportation to work. But because of Debbie's disability, she needs to take paratransit or door-to-door transit, mobility transit, something that comes into her neighborhood outside of her house or apartment and takes her directly to work. So she needs that. So she's managed to get $36 a month. So let's look at how that's calculated. Here is her example. So she has gross earnings of $640. Social Security will subtract the two exclusions, the total of 85, with the remainder will be 555. And here is where we will subtract the impairment related work expense of $36. And that leaves us with a total of $519. And then remember in the old SSI, how to figure out how wages impact earnings, you divide the remainder by 2, and you're left with what's the total countable earned income, or the amount that their check will be reduced. So in the next line, the base SSI rate is 943. You subtract Debbie's new total countable income, which is 259, and she gets an adjusted SSI payment of 683.50. And so between her SSI payment and her work, her new financial outcome is going to be $1,323.50, which is, you know, nearly double. She's kind of doubled the amount that she's getting, almost at least, between the two, and has a lot more money at her disposal. This is SSI impasse. You want me to do that?
You do that, yeah. You
Okay.
can take them on through all the rest of the way.
Okay, great. So SSI is something that if you're receiving and you're going to work or you have gone to work, you may be eligible for a plan for achieving self-support, which the acronym is a PASS plan. And a PASS plan is an SSI work incentive that allows a person with a disability to set aside income and or their resources for a certain amount of time, for a specified time that they come up with, in order to pay for an item or a service that's needed in order for them to achieve a work goal. And so we'll look at a couple of examples because people are always thinking, you know, what would be covered under a PASS plan? What would Social Security consider to be something that they would let you set aside money for a period of time without it incurring any penalty or anything? So you could set aside money to pay for education or training. Let's say you want to go to the community college and get a sous chef certification. You could do that possibly, and you'd identify how long that would take you and how much that would cost, and the books, supplies, and fees. And we'll look at the form in a little bit as well. So you kind of just need to be thinking of first, what is it that you are going to set aside to pay for something that's going to elevate your career or your job? You could set aside money or resources to pay for job coaching or some other type of support. You could do an on-site job coach. You might even be able to find a company that can do some virtual supports and give you, you know, some support that way without necessarily being on the job site. Or you could have a coach there with you that's going to help out. A PASS plan could also possibly play for transportation. And with transportation, that's going to be a long-term expense. And remember, PASS is time limited because you have to identify the amount of time. So it's generally used for something like possibly purchasing a secondhand vehicle that's good and reliable. If you live maybe like not on a bus route, or there's no, you know, how are you going to get from where you live to where the jobs are? So that could be considered. Job-related items that that you need and that your employer's not supplying because they've reasonably accommodated you already, and this is something that you definitely need to be able to travel to and from work and to do your job, but it may not be considered that it's required or that you're going to need it to perform everything. For people who are starting their own businesses, this is even, it will make more sense. You could possibly be set aside money to buy equipment, maybe to start a business. So that could be something like if you're somebody who wanted to do mobile car washing, you may want to set aside some money to buy the truck or the van or the vehicle that would be used to go in the community, to go to where people had online requested you to come and wash their dirty car, detail their car. And then, you know, so you can begin starting to plan for things. Now, this is likely something that you would want to have the help of a certified work incentive counselor. So we encourage you to reach out when you're trying to problem solve and plan for these sort of things. Rose and I have developed a few of these for people who have qualified, and we've been able to help them formalize it and put it into some sort of plan and on the form. And really just about anything else needed to achieve an occupational goal. But I do want to say there's, you know, a caveat. Whatever you're buying has to be reasonable and it has to be justified. So you're not going to just be able to go out and buy cars and buy vans and equipment and things like that. It's going to have to be because they're going to have to let you rely on what other people would do. So if other people would take a bus, or if other people might, you know, get a small loan or apply for a grant to be able to start, like, so those are the sort of things that in the application process you get to justify why it is you need this amount of money. And they'll be very prudent about how much they give. So they'll kind of want to just, if they do find it useful and relevant, they'll just want to give you exactly, you know, what that amount is. So it's tremendously underutilized, and we would like to see more people be able to think about it. And we get it that it's hard for people sometimes to come up with things that they think might qualify. So we'd be willing to help with any of those things. Well, now we're kind of switching gears, and we're going to talk about, for us, Louisiana Rehabilitation Services, but every state in the nation has a vocational rehabilitation agency that's funded from the federal government and then partly by the state. And so one of the things we know that these vocational rehab services agencies have is something that's called pre-employment transition services. And those were within the Workforce Investment Opportunity Act that was signed in 2014 and came into policy, came out to the community for practice and services in 2016. And that allows students between the ages of 16 and 22 to receive some really great job exploration counseling. These units that are done with them either in a classroom or in the community or one-on-one or sometimes in groups. Some work-based learning opportunities, which sometimes can also be called internships or apprenticeships, where somebody's practicing being a worker for an employer and hopefully getting paid. We like to see paid work-based learning opportunities. Then there's counseling on opportunities for enrollment in comprehensive transition or post-secondary education programs at institutions of higher ed. So that big long sentence means that here's an opportunity for community rehab providers to be able to work one-on-one with individuals who are wondering whether they might be able to take either a class at a community college or a course at an undergraduate school or beyond, to be able to get certification or some training or some knowledge so that they can improve their career profile. And so that's something now that people can work with that person and try to identify that. The fourth thing is workplace readiness training to develop social skills and independent living. So that can be all the supports and training that happen in the community on job sites. Could include things like, how to ride a bus, and how to be able to budget and allocate money so that you have enough for the whole month and the week. And then finally, instruction in self-advocacy. So that's really important. So these weren't previously available in a package before 2016. Most Louisiana Rehab Services did some of these things, especially the counseling and allocating the funding for some of these sort of things, but there's an improved amount of services that were earmarked in this. Here's a list of all the things that are available through Louisiana Rehabilitation Services and any state vocational rehab agency. They all have these 10 or 12, available. I think that, their agencies are focused on getting people jobs, but also they have a sub-focus of helping people get the training and the credentials necessary to get a better job. So they're not just satisfied when you're in a job. If you get to a point where you'd like to get a raise or you'd like to move to another type of job or you'd like to take some coursework while you're working so that you can get a better job, they can do that. Some of the key things that you should be aware of, aside from doing all the help with getting a job and guidance and counseling, is they have also rehabilitation technology and assistive technology. So this is critical for nearly everyone, but we all have our own way of adapting and modifying our workspace and how we use our computers and how the heights of our desks and all that. It's a little more complex, and there's actually people who are trained and skilled in that area to be able to come in and look at your workstation and look at the work that's essential that you must perform and to see if there's any assistive technology that's available for you. So occupational tools and equipment, and then any maintenance to cover any additional costs that you would be incurred during a period of voc rehab. So lots of people are trying to get out there and get a job, and they're able to maybe do that, but then they might have trouble keeping it. But then also they're thinking they'd like to maybe get a promotion at that job, or they'd like to move on to even a different type of career that may be related, but might not be. So that's really important. They also can offer personal assistance services like a personal care attendant, or sometimes called a direct support worker, somebody who may be able to help somebody who needs that sort of assistance in eating lunch or that kind of thing. It could be a scribe or a reader or interpreter. And those are critical things for people who need that. And so it's important that you would remember all of those services that are available in your state agency at no cost to you. Now here for benefits planner is probably the most important slide of all the slides here. We need you to report your earnings. If you don't report your earnings, it will mean that you will get paid monies that might possibly, that shouldn't have been paid to you because they think you're not working. And so because they are a federal agency, even state agencies would have to do it, they're mandated to get back any of the money that they paid that wasn't due to the person. So at some point, when your employer pays you a wage, they have to also send a report to the state tax agency and the federal tax agency showing the wages that were paid to all employees. And the ones that get SSI or SSDI are flagged. And so that does a report within Social Security that basically produces all the overpayments that have been made to the workers. And so, they have a way to track all this stuff in the computer. So you have to report those monthly earnings by the 6th of the month following the earnings. And that's so that Social Security can adjust what they're going to pay you, because you're going to have to pay anything back that they do pay you. And that may be over time that can accumulate. And if you have an extra $100 a month or an extra $200 a month for 12 months, you're going to owe, $2,400. And that's a lot of money that, to be able to have to pay that back, all at once. Now they can maybe they can work with you to try to get a repayment plan, but you want to avoid that because you want to avoid having any debts or bills that were just because you didn't report. So the first report should be by phone with a written follow-up and with a detailed cover letter and pay stub. So you may need to get somebody to help you with that. And I'm going to say, anytime you need help with your benefits, the people to call are your certified work incentive counselors. And those programs are available in every state. If you're listening to this and don't live in the state of Louisiana, you have
At no cost.
At no cost. And we do not work for Social Security. We're third-party contracts in every state. And we're the people who kind of know about community rehab programs and supportive housing and food stamps and all the other things. And all we do is help people figure out, how can I go to work and still keep the necessary benefits that, that I have to keep. So after the employer is listed on the person's record, you can report by phone, in writing. You can do it online at the MySSA account. And if you don't have a Social Security account, you need to look at that and go to ssa.gov and create an account. It will show you your earnings and kind of your status with them. And that's pretty important that that's exact and it's precise and it's correct. You can do a telephone wage report, or you can use the app. So they really are trying to get everybody to report their earnings. Here's some important resources for reporting. You can find the following forms on our website under Social Security forms. So if you go to our LSU Health Human Development Center at the link below here, you're going to be able to go to those resources, which talk about SSI wage reporting in general. It's like a fact sheet. And then at the SSI telephone wage reporting instructions and how to create a Social Security account. So you can do that independently on your own. And if you can't remember what slide this was on and you want to get some help, you can reach out to us and we can happily, you can try by phone, but you can also send an email to us and we can send you the link again so that you have it. We want to make sure people are getting, what they need to get. The big message, I think, that's most important to tell you and other people who get SSI or SSDI, that truthfully, paid employment and Social Security disability benefits, they do not have to be mutually exclusive. And that's why we exist. We're here to counsel people on how to keep required or necessary benefits, but yet to go to work. And so we recognize that people are not all going to be able to work full time and are not all going to be able to make 20 or 30 or $40 an hour. And that we need to try to find the way that works for that individual and help them find programs in the community that can help them. And then to make sure they get all the work incentives and exclusions that they are allowed to get. And so there'd be no way you necessarily know all those. So the message here is it's possible to work even full-time and keep your Medicaid and or your Medicare in almost every case. That's the thing that people think they're going to lose their health benefits. And the second thing is it's possible to work and come out financially ahead, even if your benefits are reduced or stopped. And you're the one that's going to make those decisions if how much they're reduced or if they're going to get stopped. Some people elect to go to work and make as much money as they can for as long as they can. And so, you make those choices. It doesn't mean you can't ever go back, be put on benefits again if you were to lose your job or if your disability required more supports and that you couldn't work as often. So that's, it is possible to get the benefits back. I've heard lots of horror stories about people who went to work and lost their job and waited months or years or maybe never got back on. And I think those are from decades ago, before Social Security started to change some of the rules so that it made more sense that people could go to work. It's often thought that if you get SSI or SSDI, you can't go to work. And that's simply not the case. It definitely is an agency that supports people going to work. And they're the agency that supports us helping people to find out how they can go to work and how they can get the supports they need. Rose, are you doing any of these transition age youth priority for WIPA?
Well, I'll let you keep going.
Okay, I just want to make sure I wasn't hogging the show. So interestingly enough, just as the Workforce Investment Opportunity Act has an emphasis or a focus on transition age students leaving school and coming into the community or work, Social Security has had for some time now a transition aged youth as a WIPA priority, a work incentive planning assistance priority, which is great because we're starting to see those people as they're exiting school and making sure that they and their parents and their family members know that you can go to work, and they have student earned income exclusions, and there's all kinds of things that we can do with IRWIs and past plans to help somebody really go into a career and kind of elevate themselves through employment in the community. So they have a priority to assist transition age youth interested in working. And so we can deal directly with those individuals who have lots of questions initially and they're younger, and people are trying to figure out, where do I go? What do I do? Typically, we work with people who are just getting ready to go to their VR agency and get support, or just getting ready to be interviewed by an employer, just about to be hired. But we can work with the transition age youth a little younger and maybe before they actually identify the exact employer and that sort of thing. So this is individuals that are between 14 and 25. So you can see 14 is usually earlier than we think of people going to work. But most people with disabilities in a good school system and a good program are getting some talk about work and maybe even doing some in-school kind of work tasks. Okay. So here's some information to remain with you so you kind of know what we do. Work incentives, planning and assistance was created as part of the Ticket to Work Act of 1999. So it's been around a while. We got one of the first grants here at LSU Health Human Development Center in 2000. The grants came out in 99 and I think started right at 2000. So Social Security has these cooperative agreements with 83 community agencies to provide the services that we're talking about. Free services to you. We get paid by Social Security through a third-party agreement. And we have to remain certified at the whole time and go through yearly training to update the skills that we have. So, all of our staff are certified work incentive counselors, and so we have to meet the qualifications that are identified at the National Training Center. Well, to date, the WIPA projects across the nation have actually served over 750,000 individuals. So it seems like it's at times, sometimes we're like a secret program, but we're trying to spread the word. We want everybody to know that we're here to, to work with you and help people figure out some of the stuff before they get themselves decide they shouldn't go to work or can't go to work and those sort of things. Now here you're looking at our map. So this is the HDC map of where we serve. And we serve the shaded areas of this map. So we serve 33 Louisiana parishes that are in, so from central all the way up to North Louisiana. And we actually also serve 21 counties in Texas, in the state of Texas. And so the area below us is served by an agency called Louisiana Lighthouse, and we can give you their contact information. It might be here. If not, we can tell you how to get there, and you can also use the helpline number. It's going to be on the next slide. So this is where we serve. So all the services are done virtually, by the phone, sometimes by Zoom, whatever works. We don't do in-person counseling, like one-on-one. We don't drive up to, we're located in New Orleans, so it'd be a long drive to get up to Shreveport for a 1-hour meeting with a customer about their benefits. So we're able to do that. So the WIPA contact information is you can make a direct ticket to work referral at the helpline, and the number's listed here. Monday through Friday from 8 in the morning to 8 at night. That's Eastern time. And then you can email for general ticket to work inquiries to support@choosework.ssa.gov. And our website is listed here, and you can be able to see the external beneficiary referral form and some of the resources that we spoke about. Okay, our last slide this is who we are and our email addresses. So my name is Sue Kellum. I'm the project director. Rose and Donald are certified work incentive counselor, and they do the hardest work. They're the individuals who are providing one-on-one benefits counseling to individuals and developing a report that's called the benefits summary and analysis that really provides a comprehensive rundown of what's going to happen with your wages and benefits and healthcare, and the strategies to be able to circumvent any areas that you could have an exclusion or could, have some support in that area. So we're delighted that you joined us today. We hope that you will use our resources or contact us if you think that we can provide some help if you have some issues. So thank you very much.
Thank you.